Howdy, my name is Sarah Mendez and I'm a doctoral student at the Texas A&M University School of Public Health. My presentation is on the analysis of a nonprofit health sector in rural versus urban areas. To do this, we will be looking at a comparison of the nonprofit health sector in the Brazos Valley compared to the nonprofit health sector in Austin, Texas. First, I want to give a little bit of background on the nonprofit health sector. In the early 1900s, hospitals were founded on charitable care, and they cared for those that were disabled, chronically ill, and deprived. Wealthy Americans, on the other hand, were cared for at home by family members. Through the years, care at hospitals shifted from serving the poor to those with the means to pay. However, there were still gaps in services, which led to the nonprofit hospital that we see today. In addition to the nonprofit hospital, there are 99 different tax codes in the nonprofit health sector in the National Taxonomy of Exempt Entities. Examples of these organizations include, as we already talked about, hospitals, community clinics, and public health organizations. There are several key issues that impact the nonprofit health sector. First is the lack of resources to provide care, and this could be either through funding or through staff. Second is insurance reimbursement rates. Even with private insurance, reimbursement rates can be low, and especially in public programs such as Medicaid and Medicare. Next is government funding. With government funding and the Affordable Care Act, there are numerous monitoring requirements and reporting that goes along with the funding. And again, this can be an issue for smaller nonprofit organizations. Next is data protection laws and digitalization. This looks specifically at technology such as EMRs, or electronic medical records, as well as how those EMRs protect the data of their clients and patients. And last, the last key issue is looking at community health needs assessments. Nonprofit hospitals are required to do a community health needs assessment every 3 years. And in addition to this assessment, they are required to determine certain issues or priorities from that assessment that the hospital will focus on. Because of the complexity of a needs assessment, the cost, and the community partners, this again can be an issue for smaller nonprofit hospitals. Next, we'll look at the methods that I used for my analysis project. So in this analysis project, I'm looking at the Brazos Valley, which is considered a rural area, and comparing it to Austin, Texas, which is considered an urban area, to determine what the nonprofit health sector looks like in these two areas. The Brazos Valley is made up of 7 counties, including Brazos, Leon, Madison, Grimes, Washington, Burleson, and Robertson counties. Austin, on the other hand, is an urban city that is actually the 11th largest city in the United States. So first, I looked at what was going on nationally in the nonprofit health sector. So I utilized 3 sources to compare the size of the nonprofit health sector. First, I looked at our textbook, Nonprofits and Government, the Collaboration and Conflict. Second, I looked at the National Center for Charitable Statistics. And third, I looked at GuideStar. The National Center for Charitable Statistics and GuideStar are both online resources that focus on nonprofit organizations. Specifically to look at the Brazos Valley in Austin, Texas, I used GuideStar again. I use this to determine the total number and funding amounts of nonprofit healthcare organizations in these two areas, as well as I used GuideStar to look at funding amounts. And funding amounts were looked at specifically using the IRS 990 form. This form is an annual form that is submitted to the IRS by nonprofit organizations. The type of 990 form that is used depends on gross receipts. Gross receipts are the total amounts that an organization receives from all sources without subtracting any costs or expenses. And as you can see, a 990N form is with gross receipts that are less than or equal to $50,000. The Form 990EC is used when an agency's gross receipts are less than $200,000. And the 990 is when an agency's gross receipts are greater than or equal to $200,000. I also looked at the United States Census Bureau data to determine the population size of both the Brazos Valley and Austin, Texas, as well as I used the census data to look at the percent of persons living in poverty in each of these areas, as well as the percent of persons without health insurance. So by looking at all these data resources, these are the results that I found. First, I looked at the IRS annual return form type for agencies in the Brazos Valley. As you can see from this pie chart, majority of the agencies complete a 990N form. Actually, it's 64% of the nonprofit health organizations in the Brazos Valley have less than $50,000 in gross receipts. This is compared to the IRS annual return form type for agencies in Austin, Texas, where 44% of nonprofit health organizations in Austin have less than $50,000 in gross receipts. So when we look at the population comparison of these two areas, this is what we find. In the Brazos Valley, there are 357,591 people, and this is based on the 2018 estimates from the Census Bureau. And in Austin, Texas, there are 964,254 people. In the Brazos Valley, the percentage of persons in poverty is 17.6%, and the percentage of persons without health insurance is 20.6%. In comparison to Austin, the percentage of persons in poverty is 15.4%, and the percentage of persons without health insurance is 15.3%. So as you can see from this comparison, although the total population of Austin is much higher than the Brazos Valley, there are a lower percentage of people in poverty, as well as a lower percentage of persons without health insurance. And if we compare this to the number of agencies that complete the 990N form, we can see that those living in Austin, Texas, have more nonprofit agencies that have more funds available compared to those living in the Brazos Valley, where there are more people living in poverty and uninsured, but have less resources and less agencies to access. So, in conclusion for this analysis, we can see that urban areas have more funding and resources to provide services. However, rural areas have higher populations living in poverty and the percent of persons without health insurance. There are several implications of the nonprofit health sector that nonprofit and public leaders must consider. First is behavioral health. Behavioral health continues to be a need with very limited resources available, especially in the rural areas. Second is the baby boomer generation continues to age with longer lifespans. As this population grows, more healthcare services are needed, which could put an even further strain on the current Medicare system. Third, there needs to be a focus on workforce development to encourage professionals to provide care in a nonprofit health sector. And finally, leaders must focus on fund development and search for other funding sources besides just reimbursements from government programs and private insurance. Residents in rural communities give less than those living in urban populations. However, in rural areas, giving is seen as a common way to express religious beliefs. Nonprofit leaders can use this belief to solicit donors in rural areas. Thank you for listening to my presentation.